I'm assistant professor in the department of Shalakya Tantra, SJM Ayurveda College, Bangalore. So before going to actual topics or how to study, we should know how the syllabus is formed. Okay, so you are well aware of this. Since 3 years, you are reading this like from the first year itself. So to brief, so you have two papers, paper 1 and paper 2, each carrying 200 marks, 100 theory and 100 practical. Okay, so that 100 mark paper is divided into 20 multiple choice questions, 8 short answer questions and 4 long answer questions. Okay, so total it makes 100 marks. So now we'll understand from where the questions are picked. Okay, each 100 mark question paper is containing 20 marks MCQ, 8 SAQ and 4 LAQ. MCQ majority are drawn from must to know syllabus, that is 15. Okay, so maximum 3 questions can be asked from desire to know and 2 questions from nice to know. So 15 or more from must to know topic, 3 or less, that is it may be 1 or 2 also from desire to know, 1 or 2 from nice to know. So majority from MCQs are from must to know topic, and SAQ, that is 7 questions from should be asked from must to know topic and only 1 from desire to know. And here nice to know topics are not there. Okay, so but it can be testing your understanding, application and analysis. Okay, it may not be always direct question. In LAQs, so all questions are from must to know topic. So majority, that is 90 marks questions are from your must to know topic and only 10 marks can be asked from desire to know or from the nice to know. 2 marks are from nice to know. So majority, that is 90 marks are from must to know topic. Okay, and LAQs are formed, structured in a way that they can assess your higher cognitive ability, such as application of the topic or analysis or synthesis. Okay, so now we'll know how the questions are formed. So you should know what are LAQ topics and what are SAQ topics, and MCQ can come from anywhere. Okay, so any part of the syllabus. So they have given some set of topics like 30 and 31 are one set. So from there only 10 marks will come. Okay, so and in that one question, one topic is there for long answer. So Samanya Chikitsa of Shiroroga, and otherwise you can expect 1 short answer question and or 2 short answer questions from this topic, or 1 SAQ and 2 MCQ. Okay, so it won't make 10 marks. So probably you can expect 10 marks question. Then next set of topics are Karna Rachana Sharira, Karna Roga, Nasa Sharira, Pratishyaya, Mukha Sharira. So it makes 25 marks. Maximum questions are drawn from here. So 2 topics are there for LAQ. Okay, so from here it makes 20 marks and 5 MCQ can come, or 1 LAQ, 2 SAQ and 5 MCQ will come from this topic. Okay, these 5 topics. Then next set is Oshtaroga, Sarvasara Mukharoga and National Oral Health Program. So from here 10 marks questions will be asked. Okay, there is no LAQ topics, only SAQ and MCQ topics. So you can expect 1 SAQ or 2 SAQ from here. Sarvasara Mukharoga is important. Oshtaroga, in Oshtaroga, Kandoshta is very important. So you can expect SAQ and MCQ from here. Next set is Kapalagata Roga, Karna Kriya Sharira, Karna Badiriya, Karna Nada, Karna Kshveda, Karna Kshveda. So from here 10 marks question they will ask. So 1 topic is there for LAQ, that is Karna Badiriya, Karna Nada and Kshveda. So either they can ask Badiriya for LAQ or Karna Nada and Karna Kshveda. Okay, otherwise all the 3 can be asked for 10 marks if direct question. Then so 5 marks question, Karna Rachana Sharira is very important, or physiology of hearing is important. Kapalagata Rogas, Kalitya Palitya can be asked. Okay, so for 5 marks. The next set of topics are Karnasrava, Putikarna, Karnakandu, Karnagutaka, Karnapratinaha, Krimikarna, Karnaviddadi, Karnapaka, Rhinitis, Diptadinasaroga. So here there are no LAQ topics, only SAQ or MCQ. So only 5 marks is allotted to these topics. So you can expect rhinitis or like Karnasrava can come for 5 marks, okay, or Putikarna. These are important topics. Or Karnagutaka, okay. Karnagutaka and Karnakandu can be asked. Next set is Nasavamsha Kutilatva, deviated nasal septum, Dantamulagata Roga, Jihvagata Roga, Krimidanta, Dantaharsha, Dravyas used in Karnanasa Mukha. So only 10 marks is allotted to these topics, but 2 LAQ topics are there, that is Nasavamsha Kutilatva DNS and Krimidanta. So expected one, many times repeated one is Krimidanta. Along with that you can expect Nasavamsha Kutilatva also. So otherwise they can ask 1 5 marks and 5 MCQs from this topic. Okay, these topics. Next set is Karnarsha, Karnarbuda, Karnasandhana and Brahma. Okay, so there are no LAQ topics, only SAQ and MCQ topics. So you can expect 1 5 marks question and other MCQs. Okay, so Brahma can be asked, or Karnarsha, Karnarbuda can be asked. In some question papers, Karnasandhana also asked. Then next set of topics are Agantuja Shallen Karna, Nasarsha, Nasagata Rakta Srava or Rakta Pitta, Nasarbuda. So in these topics, 2 are LAQ topics, that is Nasarsha and Nasagata Raktasrava, very, very important topics. They can ask like Nasarsha. So nasal polyp, you have to differentiate between ethmoidal polyp and antrochoanal polyp, or nas polyp as such, Nasarsha as such they may ask, or Nasagata Raktasrava, they can ask management also along with causes. So you have to write in detail. Okay, so otherwise any one question will come from this topic. Okay, LAQ. So otherwise they can ask 1 SAQ and MCQ. Okay. So next last set of topics are Agantuja Shalya in Nasa, Nasa Abhigata, Nasa Sandhana, Talugata Roga and Kantakata Roga. At last, Dravyas used in Karna Nasa Mukha Roga Chikitsa 2. Okay. So in this 2 topics are there for LAQ, but they are desired to know topics. Okay, not must to know topics. All other LAQ topics are must to know topics. Okay, so you can least expect these Talugata and Kantakata Rogas for LAQ if they are set paper as such your user manual. Okay, so only 10 marks are allotted to these 5 topics. So you can expect for 5 marks question Tundikeri or Kantashaluka, that is adenoid hypertrophy, or Rohini can be asked. Okay, or Nasa Sandhana can be asked. Otherwise, foreign body removal from nose can be asked. Okay, so this is your topics, whole paper to topics and marks allotment. So you have to study these highlighted topics for LAQ. That is application level you have to study. Okay. So now we'll see study tips, how to study these topics. So there are many topics, 4 major portions are covered, like Shiroroga, Mukharoga, Karnaroga and Nasaroga. How to study? So there are many diseases. Disease wise, if you see 65 Mukharogas, 31 Nasarogas, 28 Karnarogas plus 10 Bahya Karnarogas and 19 Shirogata Rogas. So how to study? Okay, so by seeing number, we'll get panic, right? How to study, how to remember, what are the important topics in this, which disease is important, how to write, all these are question marks. So my tip is don't get panic, study one by one. Okay, so be calm and study. Focus on your study now. Okay, don't get deviated or distractions, or close all the social media accounts. Okay, so now we'll see. So first thing is equal time distribution to all MK topics, that is must to know topics. You cannot skip any must to know topics. Okay, so read all the topics once or twice. and then revise only must to know topics. Understand the concept. So once you read, understand the concept, then memorize. So how to memorize? By, if you have created short notes or concise notes, you have to visualize that. Okay, otherwise any flow charts or diagrams, that is easy way of remembering. Okay, visualization. So photogenic memory. Then association. So if some topics are interlinked, you have to study like that only. Then it will be memorized very fast. Then having mnemonics, that is codes. Okay, so you can have the mnemonics in one sentence or one paragraph or one small abbreviations. So that is up to you how you will prepare. Okay, then you have to prepare concise notes. That is always good. If you, when you read once or twice, you have to read and you have to write it in a paper. That is only subheadings and points, not detailed notes. Okay, so in one sheet probably 8 to 10 topics you can prepare. Okay, so review after 2 or 3 days or 1 week. So how much you'll recollect or how much you are remembering, that helps to revalidate. Okay, then, so best way is whatever you have learned, you have to teach to others. So if you may be having tea time or dinner time or 5 to 10 minutes break in between. So you go to your friends and explain. So if they do the same, you listen. Okay, so that is best way of learning. Then minimize distractions. As I said, you have to shut your social media. Okay, so then you have, very important is you have to have proper sleep and food. Otherwise, so in exam time, gastritis, diarrhea, Bajatisara, everything is very common. Okay, so you have to have very good sleep, because with that only very good memory will come. Okay, so nidrayattam sukham dukkam pushtim kashim balabalam. Okay, all the other depends on sleep only. So all these are, this is one among Trayopastamba. Okay, yes. So how to get success in exam? So as far as I know, there are 3 to 4 strategies. Okay, so one is effective study strategy. That is, you have to read properly all the topics. So you have to revise must to know topics, very important desire to know topics. You have to improve on writing skills. That is, you have to use more of shlokas, otherwise no Sanskrit terms. Okay, so if Sanskrit terms in bullet wise or point wise, then flowcharts, tables, diagrams, so that will improve your writing skills. Okay, then, so if you, once you study and understand how is the syllabus formed and QP blueprint, if you know, then it gives confidence. Okay, so read all the questions properly for effective time management. Then first you have to, as far as my knowledge and how I have studied, that is, first you have to attempt MCQs or 3 marks questions. In our time it was 3 marks question. So first you have to write MCQs. So that too within 15 minutes. Okay, so if you don't know MCQ, leave it like that only. So 1 or 2 MCQ may be very difficult, that you leave. Okay, then go to SAQ. So initially our hands are not well adjusted to writing. Okay, so it takes 15 to 20 minutes to get adjusted. So all muscles. So once it is adjusted, you can write fast. Okay, so another 60 to 70 minutes are for SAQ. So with that you have to finish. Don't leave any MCQ or SAQ. Okay, so attend all the questions. So how much you know, that you have to write. So what you know is different from how you write. Okay, so you should know what are the points to be written if the same question is asked for 10 marks or if the same question is asked for 5 marks. So that is why you should have a concise notes and subheadings. So then after 15 and 70 minutes used for MCQ and SAQ, last 80 minutes are left. That is for LAQ. Okay, so here, as I said, they may ask analytical based, application based questions. So you need to think and write. Okay, so that is why it requires little more time. So attend all the questions equally. Okay, don't leave any questions. If you write, see, for LAQ, if they give 5 pages, it's okay if you write up to 4 pages also. Okay, so but for MCQ, you have to write correctly. So don't write in other questions. Okay, so if you leave place or if you leave some pages, you may get confused where to write in exam tension. So just see pages and question paper, question number. Okay, so you have to write properly in that stipulated pages only. So that will give you more marks. Okay, so how to deal with the exam stress? So you should be calm, you should be revising properly. So you should have a proper sleep and proper food, then only you will remember in exam. So if you study hardly for all these days, and at the day of examination if you fall sick, then the whole effort is wasted. Okay, so be healthy and study properly. Then, so now we'll discuss some few points in Mukharoga, Shiroroga, Karnaroga, so which are important from exam point of view. Okay, so in Mukharoga, so definition of Mukharoga Adhishtana, Nidana, Sankhya, enumeration, Samanya Chikitsa, Patyapatya, and few important Mukharogas. So like Shitada, then Krimidanta, Khandoshta, CAs, okay, halitosis. So all these are important. Then Mukhapaka, that is Sarvasara Mukhapakas. So these are very important topics which you cannot skip. Okay. So the topics are, topic 36 is must to know topic, Mukha Sharira and Nidana Panchaka. So it is not there for 10 marks. Okay. So only 5 marks. So in this, anatomy can be asked, that is tongue anatomy, teeth anatomy, and larynx anatomy are very, very important. So you should know that. So if at all the anatomy is asked, you can use diagrams or flowchart to define the parts and all. Okay. So then classification based on Adhishtana and Sadhya Sadhyata is very important. It has been asked many of the times in question paper. Then Samanya Chikitsa, in that they have highlighted Kavala, Gandusha, Pratisarana, indication, contraindication, types, and procedure. So if at all they have asked these procedures, you should define it first, then write the references where and all you will find Kavala, Gandusha reference, types, indication, contraindication, then dravyas used, then that is in age-wise indication. Then you have to write specific indication, that is they have told Kshira in case of Pittaja Mukapaka, Madhudaka in case of Kafaja Mukapaka, or Ksharajala in case of Kafaja Mukapaka, like that. So you can remember 3 to 5 yogas specific to some disease. Okay, then you can write procedure. So any procedure if they ask, you have to write in pre-op, post-op, or pre-op, main procedure, and post-op, that is Pura Karma, Pradhana Karma, and Paschat Karma. Okay, then you can write Samyak Lakshana. Okay, so that completes the answer. Then Patyapatya of Mukharoga along with Nidana Panchaka has been asked. Nidana, you have to study all the Nidana shlokas. That is very good if you studied, because they will ask in repeatedly. It has been asked in question paper as well as in Viva. Okay, so Mukharoga, Nidana Panchaka, and enumeration is very, very important. Numbers also. So they can ask numbers for MCQs. Okay. So in topic 37, that is must to know topic, elaborate clinical features and treatment of Vataja, Pittaja, Kafaja, Oshtakopa, and Kandoshta, Jalarbuda, herpes labialis, and lip mucosa. So here Kandoshta is very, very important. Once again, there are no 10 marks questions from Oshtaroga. So you can prepare 5 marks questions, like they can ask Oshtaroga in general. Then you have to write the number, you have to enumerate and write one line of lakshanas of each, and in general treatment. Okay, So no need to write modern treatment if they ask for Oshtaroga for 5 marks. So if they ask specifically Kandoshta, then you have to write Ayurveda as well as modern part along with surgery. Okay, surgery in brief you can write. Then topic number 38 is Sarvasara Mukharoga. It is also must to know topic. Okay, so but there are no 10 marks questions from this side, this topic, only MCQ and SCQ. So you can expect stomatitis or oral candidiasis. So if they ask oral candidiasis, you have to write Kafaja Sarvasara Mukharoga also. Okay, stomatitis, the general classification and all you have to write. Okay, so oral submucous fibrosis, tumors and all, nice to know topic. So it cannot be asked for 5 marks or 10 marks. Only MCQ will come from this topic. Okay. So then topic number 39, that is National Oral Health Program, is desire to know topic. So you can ask Oshtaroga, then Sarvasara and National Oral Health are under one heading. Only 10 marks is asked from this topic. So you can expect only MCQ from this topic. Okay. Then topic number 48 is Dantamulagata Roga. It is must to know topic. So here few diseases are very, very important. That is gingivitis can be asked for 5 marks. Periodontitis can be asked for 5 marks, or enumeration of Dantamulagata Roga and explain Shitada. So they can ask in this way. Okay. Then describe the clinical features and treatment of Paridara, Adimamsa. So impacted wisdom tooth also very important. Then describe Nidana Samprapti clinical features of Dantanadi. Okay. So till now they have asked Shitada, Upakusha, Adimamsa and gingivitis. Okay. So you can expect these for 5 marks. Then topic number 49 is Jihvagata Roga. It is also must to know topic, but it is not there for 10 marks. Okay. So only 5 diseases are there. You can easily remember Vataja, Pittaja, Kafaja, Sannipataja, and Alasa and Upajihvika. Okay. So then management of ankylosing and glossitis is there. Glossitis has been asked few times. Okay. So if they ask glossitis, you have to write Jihva Kantaka also. Then topic number 50 is very important. Krimidanta and Dantaharsha. It is must to know topic. Therefore, 10 marks. Okay. So you can expect Krimidanta for 10 marks. Then root canal, if they want to ask, it will be for 5 marks, not for 10 marks. Okay. But if they ask dental caries or Krimidanta, you have to write both for 10 marks, both Ayurveda and modern. If they ask for 5 marks, only what is asked. If modern is asked, modern part only write. Okay. If Ayurvedic part is asked, then write Krimidanta full. Topic number 61 is Talugata Roga. It is desire to know topic, but it is there for 10 marks. Okay. So expected question is tonsillitis or Tundikeri for 10 marks. So otherwise, Tundikeri can come for 5 marks also. You have to write etiology, clinical features, treatment. So treatment, elaborate. You have to elaborate. That is Tundikeri, Shastrachikitsa, you have to elaborate. Okay. It is common for Galashundika and Tundikeri. So you can easily learn it. If you learn it, it is applied for 3 to 4 Talugata Rogas. Then topic number 62 is desire to know and nice to know topic, Kantagata Roga. Here very important is Kantashaluka and Rohini. Okay. So, and enumeration, they can ask enumeration in 5 marks also. So, along with 1, so their question will be like enumerate Kantagata Roga and explain Kantashaluka, or enumerate Kantagata Roga, explain Galavidradi, because peritonsillar abscess also very important. Okay. Otherwise, pharyngitis, Ekavrinda and Vrinda are correlated to pharyngitis. So, they can ask that also for 5 marks. Then topic number 63 is Dravyas used in Karnanasa Mukha Roga. So here they have, it is desire to know topic. So if they want to ask, they can ask these mentioned drugs. Okay. That is Lakshmi Vilasarasa, Shirashula Vajrarasa, Tribhuvana Kirtirasa, Gudashunti, that is Gudanagaranasya Yoga, Rasamanikya and Sharataila. So what you have to write is, so you have to write the reference from where Lakshmi Vilasa Rasa is taken. That is exact reference. Then ingredients, indications, method of preparation, and you can use what is the mode of usage, dosage also. Okay. Then you can write what are one or two research aspect. That is, as they have given, discuss research publications. So they may ask this part also. Okay. So only one question will come from this. Yes. Moving to Shirorogas. So only 3 topics are there in your syllabus. That is topic 30, 31 and 40. Okay. So enumeration, Nidana Panchaka and Sadhya Sadhyata of Shiroroga. So it is must to know topic. Okay. So it is not there for LAQ. So you can expect this same enumeration, Samanya Nidana, Samprapti, Samanya Lakshana, Sadhya Sadhyata of Shiroroga for 5 marks, or classification of headache as per ICHD 3 can come for 5 marks. Okay. So this ICHD classification can come for MCQ also. Okay. Then in topic number 31, Samanya Chikitsa of Shiroroga, it is very important topic. It is there for 10 marks. Okay, like Suryavatta, Anantavatta, Ardhavabedaka is explained here. So primary and secondary headache also explained here. That is a migraine headache. So Ardhavabedaka can come for 10 marks. Okay. Otherwise, Suryavarta and Ardhavabedaka, they can ask two disease for 10 marks. Okay. So if they ask 2 disease, so you have to write in detail Ayurvedic part and little modern part. Okay. Then Shirasottamangatvam, Patyapatya and Samanya Chikitsa of Shiroroga is desire to know topic. So it can, if they have asked, then it will come for 5 marks. Then topic number 40 is Kapalagata Roga. It is desire to know topic. So you remember what is the number of Kapalagata Roga, who explained it, where it is explained, and like dosha predominance in Darunaka, Indralupta, Khalitya, Palitya. Okay. So that can come for MCQ, or they may ask Indralupta for 5 marks or Khalitya Palitya for 5 marks. Okay. So otherwise, if they have asked from Kapalagata Roga, it will be by enumeration, Sankhya and any 1 or 2 diseases. Okay. Next, we are moving to Karnagata Rogas. Okay. So topic number 32 is Karna Rachana Sharira, Nidana Panchaka, Samanya Nidana, Samanya Chikitsa. So it is must to know topic, but not there for LAQ. So here they have explained Rachana Sharira, enumeration, Nidana Panchaka, classification, Sadhya Sadhyata, Patya Patya, Samanya Chikitsa of Karna Roga. So very repeated question in most of the question paper is Nidana Panchaka, classification, Sadhya Sadhyata and Samanya Chikitsa of Karna Roga. Okay. Otherwise, they can ask inner ear anatomy or ear anatomy as such. So you have to use drawing diagrams, okay, flowcharts, everything. Then topic number 33, Karnagata Roga. It is must to know topic, important topic. It is there for LAQ. Okay, Karnashula can come for LAQ. So you have to write Sushruta's version as well as Vagbhata's version. Okay, and along with treatment. So in treatment, don't write Karnapurana, Karnapramajana, like one word answer. Okay. Karnapurana with what and all dravyas, that is Dashamula Taila, Arkapatra Svarasa, or Bilva Taila, Deepika Taila. So these special Tailas are enlisted here. Okay. You have to write that. So if you write dosage like 8 or 10 bindus or till the external EAC, okay, opening, that is very apt. Okay. Then Karna Shofa is there. It is not asked so frequently. Okay. So you can concentrate on Karnashula and Otalgia. Otalgia, once again, there are many causes, many classifications and signs, symptoms, that and all you can remember. Okay. Treatment also. Then topic number 41, Karna Kriya Sharira and Shravanendriya. It is must to know topic, but not there for LAQ. So physiology of hearing is very frequently asked question. Okay, Karna Kriya Sharira. Next topic is Karna Badiriya, Karnanada and Karna Shveda. It is very important topic, must to know topic are there. So it is asked for 10 marks also. LAQ is one topic for LAQ is Karna Badiriya. Okay, so Karna Badiriya, hearing loss can come for 10 marks. Application level also they can ask. Okay, Karnanada and Karnakshveda. So to differentiate between Karnanada and Karnakshveda, they can ask. So if you learn Badiriya, Nada, Shveda, Shloka, it is very good. Okay, because in Shloka only you will get the differences. Otherwise, when you are sitting in examination hall, everything appears same. At the end, you will write only Venu Goshavat. Okay, so you can remember that only. So in this, other two topics are there. That is National Program for Prevention and Control of Deafness and Noise Pollution. So these two are desire to know topic. So not be asked, but you have to read it once. Okay. Topic 43 is Karnasrava and Putikarna, must to know topic. So it can come for 5 mark. That is otitis media, ASOM, CSOM or mastoiditis. So very important topics for 5 marks. Okay. Then topic number 44, Karna Kandu, Karna Guta, Karna Pratinaha, Krimikarna, Karna Vidradi and Karna Paka. So you can expect this Karna Gutaka for 5 marks along with Karna Pratinaha or Karna Kandu. So otherwise they may ask to differentiate, okay, between Karna Paka and like Karna Gotaka or Krimi Karnaka. Okay. So automycos is also frequently asked question. Then the other topics are Karnasha and Karnadbuddha. Even though it is a must to know topic, so it is not asked very frequently. Karna Sandhana, that is frequently asked for 5 marks. Okay. So you should know the Karna Sandhana where it is told in our text, that is some in Samhitas, and what are the oroplasty steps. So how to correlate. So what are the exact steps told, what are the instruments are used, what are the pre-op procedure, post-op procedure, post-op care. So what and all medicine you have to use. Okay, so that you have to remember. Then topic number 54 is Brahma, that is vertigo, desire to know topic, but Meniere's disease or BPPV can be asked for 5 mark. Okay. Topic number 55 is Agantuja Shalya in Karna. So it is not asked so frequently. So you can expect MCQ. Okay. Topic number 34, Nasa Sharira, Gyanendriya and Nidana Panchaka of Nasa Roga. It is must to know topic, but it is not there for 10 marks. Okay, LAQ, only SAQ. So nose anatomy and physiology of olfaction is very important. So they may ask both the topics. Okay, so nose anatomy or physiology of olfaction in one question, or enumeration Samanya Hetu Nidana of each and every topic is very important. Okay, Samanya Hetu of Nasaroga, Karnaroga, Shiroga, Mukharoga. You should by heart it. What you can do is you can take down the shlokas, these 4 shlokas, Samanya Chikitsa, Samanya Samprapti and Samanya Nidana in one paper. Daily revise it. Okay, by seeing daily you will have photogenic memory, or just read it daily. Okay, no need to by heart, just read it daily 2 to 3 times. So at the end of 10 days or 12 days you will get it by heart by its own. Okay, so that is one easy way, daily reading. Okay, so if you are reading, if you have by hearted it, well and good. Otherwise you can remember it, these points. The next topic is Pratishyaya. It is very important topic from examination point of view, from clinical point of view. Okay, Pratishyaya, Dushta Pratishyaya can be asked for 10 marks. Then Puyarakta, Nasa Paka, Nasa Shofa, it can be asked for MCQ. Okay. So rhinitis is next topic. It is must to know topic, but not there for 10 marks. So they can ask different types of rhinitis or allergic rhinitis or chronic rhinitis or common cold is also under rhinitis only. Okay, so all this can be asked for 5 marks only. Then Deeptadi Nasa Roga, Deepta Putaka Apinasa Putinasa Nasanaha Kshavatu. In this, Apinasa is frequently asked. Okay, so you have to prepare Apinasa for 5 marks. Then sinusitis can be asked for 5 marks. Then Nasavamsha Kutilatva, it is very important topic, must to know topic. It's there for 10 marks. So deviated nasal septum, Nasavamsha Kutilatva, you can write it for 10 marks. Okay. Then Nasarsha, as I said, it is very important. It is has been asked for 10 marks. Okay, LAQ. Nidana Panchakan Chikitsa of Nasarsha, nasal polyp. You have to study modern also. That is antroconal polyp, ethmoidal polyp, from where there are 9 to 10 points how you can differentiate ethmoid from antroconal. So that points are very, very important. Okay. Then Nasagata Raktasrava. Then here they have told fest surgery also in Nasarsha. So just remember fest surgery also. Okay, different steps. In Nasagata Raktasrava, it is also very important topic. It is there for your 10 marks question. So different types, that is 4 types of Raktasrava, how to differentiate. So what are the dosha involved, whether it is sadhya or shastra sadhya, what are the causes. Then you have to write the lakshanas. Okay, along with treatment. So treatment, nasya with what dravyas you have tried, internally what dravyas like Bolabhadarasa or Chandrakalarasa you can give, or you can give Vasasvarasanasya, Dhadimasvarasanasya. So this dravyas you have to write. Okay, so next topic is Nasar Buddha, desire to know topic. It is not so frequently asked question, so you can expect MCQ. Then Agamtuja Shalya also, even though it is must to know topic, it is not there for 10 marks. So 5 marks question you can expect. Okay, because in management it can be removed manually with the Jobson's probe or nasal foreign body removal forceps, or you can give the wash. Okay, otherwise you can do the suction. Okay, so there are many methods to remove it, and in types also it has got different types. Okay, foreign body, so it has top what content to write for 5 marks. So you have to see which and all topics are elaborately explained, so that can come for 5 marks. Okay, in Nasa Abhigata and Nasa Sandhana, even though it is must to know topic, it is not there for LAQ. So Nasa Abhigata, Nasa Sandhana, so you can expect 5 marks question. So Nasa Sandhana is most frequently asked. Okay, in this. So last 2 topics are there, that is topic number 51 and 63. These 2 are also desire to know topic. As I said, Samanya Yoga, you can expect any one of the yogas, that is Lakshmi Vilasarasa, Shirashula Vajrarasa, or Gudanagranasya, anything. Okay, and in topic number 51, so they have asked antibiotics, antihistamines, nasal decongestant, and anesthetic drugs. So which are used in Karna, Mukha, and Nasa. Okay, so they can ask that. So now, after knowing which are very important topics, which can be asked for LAQ, which can come for SAQ, so how to present? So writing is an art. Okay, so it is not just you are writing a book. So examination, so presentation in exam is an art. So even though if your handwriting is bad, you can fetch good marks by your presentation. So how to present? So first thing is write answers in correct page. Okay, so check page number and question number in advance. So you'll be going to examination hall 8:30 sharp. So 9 o'clock they will go give question paper. So in that half an hour, you have to fill your registration number, other details and all. So still there will be 10 minutes more, right? So after getting signature and all, so there will be 10 minutes given to you. So that you have to utilize correctly. So, okay. So you have to turn each and every page so that when you're writing, if you turn page also, it won't stick or you won't go to other pages. Okay. So you have to write page number correctly. Okay. So next is read questions properly. So understand questions. So few may confuse you. Okay, whether it is asked from Dantarogas or Dantamulagata Rogas, few questions can confuse you. So read question paper properly. Understand questions. Okay. Then your writing should be legible and neat. Okay. So if at all if you write mistake also, then cross out with single line. Don't scribble it. Okay. So if you scribble more, no, so the examiner's attention will go there only. So if you write some mistakes after that also, it will be caught. So automatically half mark will be deducted. Okay. So write neatly, legibly. So don't make many mistakes. So even if you write mistake, cut in single line. Okay. Then use headings and subheadings. So underline them, or so highlighting is underlining. Okay. Otherwise, just leave one short gap below that. Okay. And don't write any margins or anything on the answer paper. Okay. So don't write too much content also in one single page. Don't overcrowd it. Don't make it too spacer one. Okay. So don't give too much of space in between also. That gives wrong impression on your answer paper. Okay. Then use bullet points or tables or flowcharts. So instead of writing paragraphs, you can use all these. Then use diagrams wherever possible and label it properly. So without label, it won't fetch you marks. Okay. Then, so if you by hearted shlokas, write it. Otherwise, Sanskrit terms also fine. Okay. Then, so if you write treatment, elaborate it. So what medicines are used, what treatment is used, that you have to write. Okay. So for example, so as I told, so this is Samprapti of Pratishyaya. Chayam gata murdani marutadayaha pratak samastascha tataiva shonitam prakopyamana vividaihi prakopanaihi nrinam pratishyaya kara bhavantihi. So after writing shloka, so you can, if you write like this, nobody is going to read. Otherwise, without shloka and this description, if you write like this, it will give you marks. Okay. So it will fetch you marks. So obviously, which is presented in flowchart or diagrams or in the table, it will fetch you more marks. So it makes your answers attractive. Okay. Then next question is, so one question, Mukharoga, Adhisthana and Sankhya, they have asked for you. Then for 5 marks. So how to write it? So you write shloka, it is from Yoga Ratnakara, you have to write the reference, then simply one flowchart or in bullet, you can mention all the 7 adhishtanas. Then, so adhishtana specific numbers. So if you by heart Sushruta and Ashtangradaya, it is sufficient. You make a table and write. So that is more appealing. Okay. Then, so for elaboration, you have to write each names. Okay. So Oshtaroga, Oshtagataroga, 18 number. Just put 8 arrows and write 8 names. So likewise, Dantaroga, Dattamulagataroga, Jihvagataroga, Talugataroga, Kantagataroga, Sarvasararoga. So after writing the Oshtagataroga, Dantagataroga name, you have to mention the numbers. So that gives that indicates that you know how many diseases are there. So even if you miss 1 or 2 names, that won't make that much difference. So writing wrong numbers or without writing any number, that indicates that you don't know how much is there or how many diseases are there. Okay. So in writing numbers, that is Oshtagata 18 number, Dantaroga 18, Dantamula 15, Jihvagata 5, Talugata 9, Kantagata 17, Sarvasara 3 is very, very important. Okay. So next question, Krimi Danta. It can be asked for 10 marks or 5 marks. So if it is asked for 10 marks, how to write it? So you have to write the introduction, you have to write nidana, you have to write lakshana. So in introduction, you can write where is the reference. So it is one among 8 Dantagata Rogas, where it has been explained, Sushruta, Nidanasthana, 16th chapter, or Ashtanghradi Uttaratantra, 21st chapter. Then write Dosha Pradhanyata, it is Vata Pradhana Dosha. Then write the Sadhya Sadhyata, it is Sadhya Roga. Then write Nidana. So out of so many Aharaja and Viharaja Nidanas are therefore Mukha Roga. So don't write each and every Nidana. Okay, write whichever is apt for Krimidanta, like Madhura Ahara Sevana, Danta Adhavana, or Ikshurasa Sevana. So this will give you more marks. Okay, then in Lakshana, if you by hearted Shloka, write Shloka and write reference. Otherwise, you can write like Krishna Chidra, Chaladanta, Srava, Samramba, Maharuja, and Animittarja. So under Lakshana. Then write, so you can write Samprapti also before Lakshana. Otherwise, go to treatment. So treatment is divided into Chaladanta treatment and Achaladanta treatment. That you can put arrow mark and write. Okay. So under Achaladanta, what and all treatment has been told, that you have to write. And in Chaladanta also. At the end, you write Patya Patya. So if it has been asked for 5 marks, this much if you write, it is sufficient. Okay. So if it has been asked for 10 marks, then write dental caries also. Definition, causes, clinical classification, that is types, pit and fissure, smooth surface, acute, chronic, or primary, secondary, infant caries, adolescent caries. Okay. Then very important to write stages of tooth decay. So there are many theories. Okay. So how it will start? So you have to write decay in enamel is the first stage, decay in dentin is the next stage, and decay in pulp. Then you have to write signs and symptoms. Examination also, that is percussion test, heat and thermal test, heat and cold test. Okay. So all these under signs and symptoms. Then comes the investigations. You have to write investigations. RVG or dental X-ray. Okay, is very common one. Then you can write the treatment. So if it is very superficial one, they'll go for filling or restoration. Okay. So if it is deeper one, which reached pulp or dentin, then go for RCT and cap. Otherwise, if it is very deep dental caries, then go for tooth extraction. So this is the treatment. You have to write it. Okay. So now we'll see what are the probable. So likewise, you can plan questions and answers, how to answer well in advance for Karna Roga, Nasa Roga, and Shiro Roga. Okay. So now we'll see few probable questions from this paper too. Okay. So probable LAQ. They can ask Krimidanta or dental caries. They can ask like enumerate Talugata Rogas, write a note on Tundi Keri. Explain Nidana Samprapti Lakshana Chikitsa of Karnashula along with modern correlation. That time you have to write Otalgia also. Explain Nidana Samprapti Lakshana Chikitsa of, these are direct questions. Okay. Nasagata Rakta Pitta. Then you have to write epistasis also. Explain Nidana Samprapti Lakshana and Chikitsa of Badiria, hearing loss. Explain Chikitsa of Shirorogas in detail. Explain Nidana Samprapti Lakshana Chikitsa of Pratishyaya. Okay, so these are from your LAQ topics only. The same questions, how they can ask application based or analysis based. So they can ask like, analyze the role of Nidana Parivajjana and Samprapti Vigatana in Pratishyaya Chikitsa. So what you have to write? You have to write Nidana, you have to write Samprapti, then you have to write Chikitsa. So how Nasya or how Langana does Samprapti Vigatana? So in 1 or 2 lines. Okay. Then next question they can ask like, critically evaluate the role of Nasya Karma in the management of Pratishyaya. So that time you have to write, once again you have to write all the types, Nidana, whatever Nasya is used, then how it acts, that you have to add. Okay. Then explain the significance of Dosha Avastha, that is Ama and Nirama, Ama and Pakwa Avastha is asked in your syllabus. Okay. So that they can ask in planning the treatment. So that time It is told directly in your text that Amavastha what treatment should be done, Pakvavastha what treatment should be done. From Amavastha to convert into Pakvavastha what should be done. So that you have to write. Okay. So, and why in Samavastha we are not going for that treatment? In one line you have to explain. Then compare the Ayurvedic understanding of Karnasrava with CSOM in modern science. So you have to write Karnasrava in detail, CSOM in detail. At the end, 2 or 3 points, how it is correlating, like Karnasrava and CSOM, or Karnasrava and Putikarna and CSOM. That can be asked. Or another question, critically analyze the Shiroroga Nidana or Nasaroga Nidana or Mukharoga Nidana. That time you have to write shloka, explain it like in bullets or points. Then you can classify it into Aharaja Nidana, Viharaja Nidana, Aushadhi Nidana or Manasika Nidana, how it is causing. So each Nidana, which disease, so if like Raja Sevana, Duma Sevana, it will lead to Shita Sevana. So Nari Prasanga, Shirasobhitapa, Duma, Raja, Shita Mati Pratapaha. So these are Sadhya Nidan. Okay, for Nasaroga. What disease it will lead to? It will lead to vasomotor rhinitis or rhinitis. That you have to give. Okay, right. So if you, when they ask critical analysis, if you include few research papers, that will be very good. 1 or 2 also sufficient. Okay, so that will give you 1 marks extra. Then probable SAQs are explain Mukharoga Nidana, Patya Patya. So all these are direct questions. Okay, write a note on Kavala Gandosha or write a note on Nasya. Explain anatomy of teeth and its clinical aspect. Explain anatomy of ear and its clinical aspect, or explain physiology of ear. Then here, instead of teeth, you can expect tongue or larynx or pharynx also. Enumeration of Mukharoga along with this Adhisthana. Enumerate Dantamulagata Rogas and explain Shitada. Arthavedaka Nidana Lakshana Chikitsa in detail. Explain etiology, clinical feature, management of cleft lip and cleft palate. Okay. Describe the etiopathogenesis, clinical feature, prevention and treatment of DNS can be asked. Stomatitis can be asked. Okay. So then few MCQs are, it is from Mukharoga. So they can ask half shloka and what is this? They can ask. So otherwise they can ask numbers. Otherwise one disease, it belongs to which Gataroga, they can ask. Okay. So you need to study in detail all the must to know topics. So all these are from must to know topics only. Then treatment aspect they can ask. Okay. So healthy anatomic part, that is healthy gingiva has which color? Coral pink color. Mukharoga Adhishthanas are how many in number? So oral candidiasis is caused by which organism? Most common site of carcinoma in oral cavity. This is from topic number 39. Okay, desire to know topic it is. So then likewise you can expect NASA Roga questions like chronic rhinosinusitis is diagnosed if patients have symptoms more than how many weeks? Jalo Kavacharana is indicated in which NASA Roga? Bahushaha Shabdam Rogamahu Tam, which disease? Okay. Then they have asked a few treatment aspect also, like in topic number 53 and 61, they've asked commonly used drugs. So from there, it includes anesthesia, few other medicines also. So how much? So they can ask fist surgery and all. Okay. Then from the Karna and Shiras, Arumshiki is caused due to involvement of which dosha? According to Dallana commentary, Venu Goshavat is the Lakshana of which disease? Whether it is Karnanada or Karnakshveda. So you need to study in detail Karnanada and Karnakshveda. Okay. So central perforation of tympanic membrane is seen in which, whether it is safe or unsafe or mastoiditis or in cholesteatoma. So a common symptom of impacted earwax is conductive hearing loss. Okay. Then pale edematous nasal mucosa on anterior rhinoscopy suggests which one? Okay, whether it is allergic, atrophic or acute viral or bacterial. It is allergic. So likewise, we have many topics for MCQs also. So with this, I would like to conclude my session. So nowadays, this session is open for question and answers. Any question, you can post it. Sir?
Can you hear me?
Yeah, yeah.
Yeah. Thank you, madam, for giving a brief explanation and how to read in exam point of view for students. Thank you
Thank
so
you, sir.
much for your explanation and your concept. Students, you have any doubts, please ask. It's like you shouldn't understand any words in question paper where you have read. Take it. One question, madam.
Huh.
In Talgata Roga, uh, it's questions. In Talgata Roga, are DK, but 10 marks is given. Yes.
Yeah, that's what I told earlier. It is DK topic, but they have told like 1 minute. I'll stop presenting. Yeah. So even though it is told DK, but they have given Kantakata Roga and Talugata Roga. So Tundikeri is the only question which can be asked from Talugata Roga. So if you prepare it for 5 marks, 10 marks, you can write it for 5 marks also. So there is other topics also. So it is least expected. But if they ask, they won't ask from other topics like Kantakata Roga and other questions. They won't ask from that portion. Okay. So it can come actually. So even though it is DK, but they have if question paper is prepared as per user manual or syllabus instructions, they cannot ask it from Talugata Roga and Kantagata Roga. There are other 7 topics also, 7 to 8 topics. So only 4 questions are asked LAQ. So there are 8 topics. So probably they may not ask from Talugata and Kantagata Roga if the question paper is prepared as per your syllabus. Okay.
NK topic was given under NHLP. Point will ask from exam. Ask for exam.
See, if it is there for formative and summative both, that column you check it. If it is there for summative, they can ask. They can ask. Okay, examinations like anterior rhinoscopy or anything. They can ask actually.
And another question, madam. If Nasha and Karna Sharira should we write both Ayurveda and modern?
Yes, because in Ayurveda we don't have so much reference in detail reference. Okay, so it is very superficial. So you can finish it in 1 or 2 page. So another 3 pages left, no, and it is normal tendency. If they ask anatomy, physiology, you have to write both.
Any other questions? If you can unmute yourself, you can ask questions, no problem. If you don't have difficult to type the questions.
See, if they ask Karna Sharira, no, you have to write first Ayurveda. Very little content is there. So you can write in detail modern part only. So there you can go for brief explaining of external ear, middle ear and internal ear. So you can omit physiology, but use more of diagrams if they ask anatomy. Okay. So and parts can be written like flowcharts or tables.
Any other questions? I think they don't have any questions, madam.
See, while reading, you feel Shalakya is very easy. It is you will understand very nicely, and it is you will get in memory also. But it is as such very vanishing topic or like volatile subject. Okay, so at the end in examination hall, you will remember for all Raga, Shota, Srava. So better to learn specific terms. Okay, it is best. Otherwise, learn shlokas, which are very important disease. You can learn shloka like Tundikeri, Kantashaloka, then Krimidanta. Krimidanta, Nasagatarakta Pitta, Nasarshas. So these are very expected topics. Okay, so you can learn shlokas for this, I feel. And Nidana, don't vomit Nidana shlokas. Okay, and Samanya Chikitsa also, because always Nidana Chikitsa can be asked for 10 marks because it is there in your syllabus also, right? So 10 marks or 5 marks, any one Nidana for sure in your paper. Okay.
Thank you, madam, for giving valuable time and precious time for us and for our students. I'm very thankful for your advice and also your notes also. Thank
So
you so
wishing
much,
you
madam.
all the best for all students. Make use of your time. Don't have distractions. Okay. Plan properly, write properly. Okay. That is, wish you all the best.
Thank you so
Thank you,
much, madam.
sir.
Thank you from Ayurreshmi and from our student state. Thank you so much for your giving valuable time, madam. Thank you so much.
Thank you, sir.
And students, tomorrow we are having Komar Bhatia from Virupaksha sir, HOD from Davangere College. Tomorrow same time we will join. Thank you so much. Good night.